Welcome to Living with Restless Legs Syndrome During Cancer, Part 4 of our series. In this segment, we'll delve deeper into the daily realities of living with Restless Legs Syndrome, or RLS, especially when you're also navigating a cancer journey. We understand that managing a chronic condition like RLS on top of cancer treatment can feel overwhelming, but our goal is to provide you with practical insights and strategies. We'll explore how RLS can impact various aspects of your life, from personal relationships to work, and discuss effective ways to cope and find relief. Our aim is to empower you with knowledge and support, helping you to live as comfortably and fully as possible. Let's begin with Martin's story, which highlights a common experience. After completing his cancer treatment, Martin, like many, eagerly anticipated a return to normalcy. He envisioned getting his old life back, free from the constant demands of medical appointments and therapies. However, 2 years into hormone therapy, a new challenge emerged: restless legs. What started as a minor annoyance while watching TV with his family quickly escalated. The incessant need to move his legs made it impossible for him to sit still. This wasn't just a personal discomfort. It began to reshape his family life, making simple pleasures like movie nights or quiet evenings together difficult. Martin found himself longing for the days when he could simply relax without the relentless urge to move. Restless Legs Syndrome can profoundly restrict daily life. Simple activities that most people take for granted, like sitting through a car trip, a movie, or a family dinner, can become agonizing. The very idea of relaxation, such as an evening in front of the television, becomes a paradox, as the symptoms often worsen during quiet periods. This can lead to anticipatory anxiety as evening hours approach. Hobbies requiring stillness, like reading or intricate crafts, may need to be abandoned. This constant limitation can erode a sense of independence, leading to avoidance behaviors and a feeling of being a burden to loved ones. It's a profound loss of spontaneity, forcing careful consideration of every activity. Living with a chronic condition like RLS, especially alongside cancer, can have significant psychological effects. Many individuals experience a grieving process for the life they once had, mourning the loss of activities and ease. This can lead to a changed self-image, where one might no longer feel capable or whole. Feelings of helplessness are common, as the symptoms often feel beyond one's control, leading to frustration and despair. Additionally, some may experience guilt or shame, feeling responsible for disrupting family plans or being unable to participate fully in social activities. These emotional burdens are real and can be as challenging to manage as the physical symptoms themselves. RLS can significantly strain relationships. For partners, disrupted sleep due to a restless bedmate can lead to bedroom challenges and intimacy issues. Shared activities, once a source of connection, become difficult, leading to role shifts and communication problems. Children, especially younger ones, may not understand why a parent is constantly moving or irritable. School-aged children might have many questions, while teenagers may find it difficult to cope with the changes in family dynamics. It's crucial for families to learn about RLS together. Age-appropriate education, maintaining familiar routines, and honest communication can help. Including older children in finding solutions and seeking professional help when needed are vital strategies for maintaining family well-being. The impact of RLS can extend significantly into work and career. Jobs requiring long periods of sitting, such as office work or transportation roles, become incredibly challenging. Professions involving lengthy meetings or frequent travel can also be difficult. Conversely, jobs that allow for physical movement, offer flexible schedules, or include home office options may be more compatible. Workplace challenges include concentration problems due to chronic sleep deprivation, the need for constant movement during meetings, and reduced performance during evening hours. Solutions can involve ergonomic adjustments like height-adjustable desks, flexible work arrangements, and open communication with supervisors. Understanding legal protections can also be important for maintaining employment. Despite the significant challenges, Martin's story, like many others, demonstrates that successful adaptation and fulfilling living with RLS are entirely possible. The key principles for successful adaptation include accepting the new reality that RLS has created without giving up hope. It's about finding new ways to engage in meaningful activities and maintain relationships. Building strong support systems, including understanding family members, friends, and healthcare providers, is crucial. Focusing on what remains possible rather than mourning what has been lost can shift your perspective. Maintaining hope is also vital, understanding that treatments continue to improve. As Martin's wife Sabine wisely put it, "We had to learn that life could be different but still good." Martin is still the same person we love. We just had to find new ways to be together and support each other. Getting the right diagnosis for restless legs syndrome isn't always straightforward, as there's no single definitive test. The diagnostic process typically begins with a detailed symptom assessment, where your doctor will ask about the specific sensations you experience, when they occur, and what relieves them. This is followed by a thorough review of your medical history, including any other conditions you have and medications you're taking. A physical examination helps rule out other potential causes. Laboratory testing, often including blood tests, can check for underlying deficiencies like iron. In some cases, sleep studies might be recommended to rule out other sleep disorders that could mimic RLS symptoms. Consider Petra's journey to understanding her restless legs. After completing breast cancer treatment, Petra, an elementary school teacher, began experiencing strange, tingly sensations in her legs, like ants crawling. Initially, she worried her doctor might dismiss her concerns. However, after months of poor sleep, she consulted her family doctor, Dr. Wagner. To Petra's relief, Dr. Wagner didn't dismiss her. Instead, she conducted thorough tests and asked detailed questions about her symptoms. While Dr. Wagner suspected restless legs syndrome, she wanted to investigate further to determine the underlying cause of Petra's symptoms, understanding that a comprehensive approach was essential, especially given Petra's recent cancer treatment. Distinguishing RLS from other conditions is crucial for accurate diagnosis and effective treatment. Several problems can mimic RLS symptoms, making it challenging to pinpoint the exact cause. These include akathisia, a feeling of inner restlessness often caused by certain medications, and peripheral neuropathy, which involves nerve damage that can lead to tingling or numbness. Medication-induced movement disorders and other sleep-related movement disorders can also present similarly. Psychological and stress-related conditions, circulatory problems, and even joint and muscle issues can sometimes be mistaken for RLS. For cancer patients, who may have multiple concurrent health issues and be on various medications, careful differentiation is especially important to ensure the most appropriate treatment approach. Wolfgang's diagnostic journey illustrates the complexity many face. He saw 3 different doctors, receiving 3 different diagnoses. The first attributed his symptoms to nerve damage from chemotherapy, the second thought it was restlessness from medication, and only the third recognized it as restless legs syndrome. This experience highlights the importance of finding a doctor who takes the time to listen and ask detailed questions. Wolfgang eventually found Dr. Weber, who helped him realize he had 2 distinct problems: peripheral neuropathy from chemotherapy and RLS. Wolfgang shared, "I finally stopped waiting for the symptoms to magically disappear and instead started learning how to live successfully with them. That mental shift from hoping for a cure to focusing on effective management was really important for my emotional well-being." Managing RLS doesn't always require medication. Many non-pharmacological approaches can significantly alleviate symptoms. Regular exercise, particularly moderate activity like walking, can be very beneficial. Establishing good sleep hygiene is crucial. This includes maintaining a consistent sleep schedule, creating a comfortable sleep environment, and avoiding stimulating activities before bed. Diet and nutrition also play a role, ensuring adequate intake of certain vitamins and minerals, and avoiding triggers like caffeine can help. Finally, stress management techniques such as meditation, yoga, or deep breathing exercises can reduce symptom severity, as stress often exacerbates RLS. These lifestyle adjustments form a powerful foundation for symptom control. Suzanne's discovery highlights that effective RLS management is often more than just taking pills. After chemotherapy, Suzanne, a pragmatic individual, developed disruptive RLS symptoms. Initially, she sought medication, which provided some relief, but the symptoms eventually returned, and increased doses led to side effects. Her physical therapist, however, convinced her to try a different approach. Suzanne, initially skeptical, discovered that incorporating specific exercises, improving her sleep habits, and practicing relaxation techniques significantly improved her RLS symptoms. This experience not only provided relief, but also fundamentally changed her approach to health and well-being, demonstrating that a holistic strategy, beyond just medication, can be incredibly powerful. Building your personal program for RLS management can be a structured process. In weeks 1 and 2, focus on the foundation. Optimize your sleep hygiene, establish a regular sleep schedule, develop a relaxing evening routine, and reduce caffeine and alcohol intake. Keeping a symptom diary during this phase can be very insightful. Weeks 3 and 4 emphasize movement. Incorporate daily walking, try specific leg exercises, and experiment with using exercise as a first response to symptoms. For weeks 5 and 6, focus on relaxation. Choose a method like meditation or deep breathing, practice it daily, and use it at the first sign of symptoms. Finally, in weeks 7 and 8, explore complementary methods like heat or massage, giving them a trial period to evaluate their effectiveness and integrate what works into your daily routine. Medication treatment for RLS plays a vital role, especially for those with moderate to severe symptoms. However, for cancer patients, drug treatment can be more complex. The primary challenge is to relieve RLS symptoms without interfering with ongoing cancer treatment or placing undue stress on the body. Several factors influence medication decisions, including the severity of your RLS symptoms, your current cancer treatment status, other medications you're taking, your general physical condition, and your personal preferences. Timing considerations are also important. Sometimes it's wise to wait until certain phases of cancer treatment are completed before starting RLS medication. However, immediate treatment may be necessary to maintain quality of life and improve sleep. Thomas, a 62-year-old former teacher, experienced severe restless legs after prostate cancer treatment. He described the symptoms as a relentless, crawling sensation that made it impossible to sit still, severely impacting his relationship with his wife. He visited his oncologist, Dr. Schmidt, who, after a thorough evaluation, found Thomas's ferritin levels were low. Dr. Schmidt prescribed iron supplementation and a mild dopamine medication. This targeted approach brought Thomas significant relief, allowing him to finally rest and enjoy time with his wife again. His story underscores the importance of a comprehensive assessment, including checking for underlying deficiencies to find the most effective treatment path. When considering medication options for RLS, several categories are commonly used. Iron supplementation is often a first step, especially if blood tests reveal low iron stores, as iron deficiency can significantly contribute to RLS symptoms. Dopamine medications, which affect brain chemicals involved in movement, are frequently prescribed and can be very effective in reducing the urge to move. Alpha-2 delta ligands are another class of medications that can help calm nerve activity and improve sleep. For severe cases that don't respond to other treatments, opioids may be considered, but their use is carefully managed due to potential side effects and dependency concerns. Your doctor will determine the most appropriate medication based on your specific symptoms and overall health. As we conclude this comprehensive guide, it's important to reflect on key themes. Restless Legs Syndrome is a real and treatable condition with recognizable symptoms, understood causes, and effective treatments. You are not alone. RLS affects people from all walks of life and at all stages of the cancer journey. Knowledge is truly empowering. Understanding RLS transforms you from a helpless sufferer into an informed partner in your treatment. Remember that multiple approaches often work better than single solutions, combining medical treatments with lifestyle changes for comprehensive management. Treatment must always be individualized, as each person's situation requires a tailored approach. Finally, hope is justified. With the right knowledge, support, and treatment approach, you can not only manage your symptoms effectively, but truly live well and enjoy meaningful, fulfilling lives despite the challenges of both cancer and RLS.